Health Secretary Robert F. Kennedy Jr. is halting nearly $500 million in funding to develop vaccines using mRNA technology. Those vaccines, including the COVID shot, can teach the body's immune system to target and fight viruses that could potentially spark another pandemic. Here's our chief medical correspondent, Dr. Jon LaPook.
mRNA technology poses more risks than benefits for these respiratory viruses.
With that statement, Health and Human Services Secretary Robert F. Kennedy Jr. announced he's shutting down nearly $500 million in mRNA research. When used in a vaccine, messenger RNA delivers genetic instructions to help stimulate an immune response. It's a nimble platform that can be quickly adapted during a pandemic and rolled into production in months rather than years. But RFK Jr. claims messenger RNA vaccines are not effective against the virus that causes COVID.
mRNA vaccines don't perform well against viruses that infect the upper respiratory tract.
That contradicts research that estimates COVID vaccines saved more than 2.5 million lives worldwide during the pandemic. Messenger RNA technology was the science behind Operation Warp Speed, the program under the first Trump administration that developed COVID vaccines in less than a year.
There was absolutely no presentation of evidence or data that led him to the decision to cancel these critically important projects.
Is it unusual for somebody to make an announcement like this and then not show the research behind it?
The way the secretary released this announcement is the exact opposite of transparency.
Dr. Richard Besser is a former acting director of the CDC and now heads the Robert Wood Johnson Foundation.
Is there some gray area here as far as you're concerned?
I don't see a gray area here. We have the experience of mRNA vaccination during the pandemic, and we know it was safe, highly effective, and could rapidly be adjusted when the virus was making changes over the course of the pandemic.
But to give them the benefit of the doubt, it would be easier to react to all this, right, if we actually saw the evidence behind the decision.
My request of the secretary is show us the data, show us the evidence, convince us that your decision was the right one. Because right now, it looks like you are putting millions of people at risk.
An HHS spokesperson told CBS News key agency leaders were involved in the decision, and they followed all the proper procedures.
John, what about the people who say they took the vaccine, they still got COVID? Do they have a point?
You know, it's true that these vaccines were not as effective as we would have wanted at preventing infection, but they were highly effective at preventing hospitalization and death. And, you know, I took care of people hospitalized with COVID in April of 2020 before there were vaccines, and the death toll was staggering. These vaccines made all the difference in the world.
They kept people alive.
You bet.
All right, Dr. LaPook, thank you so much.